Hello and welcome to the fourth episode in our series on cerebral palsy. In the previous episodes, we understood the definition and classification of cerebral palsy, how the symptoms are manifested, how this can be monitored by parents of children with cerebral palsy, and what are the causes that could lead to the development of cerebral palsy. In this episode, we will try to understand how this disease is diagnosed by the doctor. Come, let us meet our expert.
So whenever a child comes to you with the symptoms, first we ask a detailed history and ask for any risk factors during the perinatal period, prenatal, natal and the postnatal period. We ask whatever causes I had mentioned, we would ask a detailed history for the same, and then we will see if it's a progressive or a non-progressive disorder. What is progressive or a non-progressive disorder? So progressive disorder means the child will gradually lose all the milestones which child had attained and slowly deteriorates. That's a progressive disorder. Non-progressive disorder, the child is delayed, but slowly the child starts to gain milestones, but not at a normal pace of the age group, but there will be a delay, but child continues to gain the milestones. So if we see children who are slowly gaining milestones and had the risk factors which we had mentioned earlier, then we do a diagnosis of cerebral palsy. We also examine the child if there is any spasticity, dystonia, ataxia, or a combination of these three, and classify it based on the clinical and the examination findings into the subtype of cerebral palsy. So when a child comes with cerebral palsy, what are the investigations we advise? So we'll try to do a MRI brain neuroimaging to confirm the extent of injury which has happened at the time of birth or prior to birth or post delivery. So neuroimaging or MRI brain is the first modality of investigations which we do. Apart from that, we do an electroencephalogram, that is nothing but EEG if the child has seizures as associated comorbidity. Other than that, we routinely assess vision and hearing in all the kids who come with developmental delay, and that is also mandatory for children with cerebral palsy. And skeletal deformities we see, and we get an X-rays or a bone density to assess the skeletal density in the kids and to decide if we have to give supplements for the same.
This concludes the fourth episode in our series on cerebral palsy. In this episode, we understood in detail how a doctor can actually see a patient with cerebral palsy and try to understand and diagnose the symptoms. What are the laboratory based investigations that are done to actually conclude the diagnosis of cerebral palsy? We'll be back with our next episode. Namaste.